everybody, my name is Mutia, I come from Indonesia. I would like to tell you about a project that is close to my heart. Homedika Healthcare is in your hand. But firstly, you will check this video, the story about Mona.
Saya punya 4 anak, 3 di antaranya sudah meninggal. Saya tidak punya biaya untuk berobat. Ayah saya mengalami kebutaan. Ibu saya ingatannya berkurang karena faktor usia. Dan suami saya sudah meninggal. Semua hal ini meninggalkan depresi yang begitu mendalam. Saya merasa sendiri, terperangkap, dan tanpa ada bantuan sama sekali. Suatu ketika Homedika datang dan bicara sama keluarga sekitar, dan kami berbicara tentang kondisi saya. Homedika membantu orang-orang kurang mampu dengan pengobatan gratis. Mereka mengetahui informasi tentang saya dan membantu saya bertemu dengan seorang perawat. Perawat itu datang ke rumah saya dan merawat ibu saya, ayah saya, dan anak saya.
So what makes health access become the big problem in our country? Firstly, we face that 60% of the people of Indonesia still without health coverage. And then we also see that health workers in Indonesia still low productivity reported by World Health Organization. So we try to provide the solution based on this platform, Homedika. What is the Homedika? Homedika is the social-based enterprise that we really want to connecting between health professionals and also patients in Indonesia, because we have a tagline, open doors for health access. How Homedika can work? Initially, the customer and user have to register in our platform. You can check in the www.homedika.com and also in our mobile apps. And then after register, they can get a confirmation to log in our platform. And after this, the user as a patient can choose the medical treatments, and our servers will confirm this, and then they can connecting to the health professional to get the treated at the home. We have 7 types of professional workers. The 3 most popular are nurses, doctors, and midwives, and the 4 others, physiotherapists, psychologists, dentists, and nutritionists. Who are our customer? Our customer is the health professionals. We targeted around 5,000 health professionals registered and verified by our platform. And who are our user? Our user, the common people of Indonesia. So it is actually really marketable and also the potential, because you can see in the purple color, it's a really become the potency of our user. And the social emphasis of this kind of the platform, we also connecting to help underprivileged, but I will tell you later in the revenue model. I would like to say thank you for the judges sharing session before this, because Mr. Chacha, Mr. Robert, and also Mr. Patra also give me advice about the focusing in the one main service. That's why this service actually the source of our transaction about the med visit. You can check this. And during 1 year program, actually we already face several things related with our service. That's why we open about the additional service such as the communication and information service. That we say that people really want to get a consultation before ordering and entering about the medical treatments. That's why we open the two access communication by this service. In addition, we also try to collaborate with the crowdfunding called the siapapeduli.id. So it is actually for support our main service in the visitation. I will tell you later in this kind of the matter. During 1 year of our program, we already measure several aspects of our business. Firstly, in the health professionals, there is almost 100 registered in our platform, and we still verify. It's around 100 to 2016 to verified health professionals. We also measure about the page views, the registered cities, registered patient, and registered partnership. And about the volunteers, actually this become the bridging between people in the rural community and the platform, because we assume that people in the rural community there is no connection about the internet and also mobile application. So it will be, we have a specific mechanism about it. Talking about the transaction, surprisingly that there is a 40 service for the communication service per week. That is depicts that Indonesian people really want to know about this kind of the platform, because they really want to ask about what kind of the treatment that can provide by Homedika. And during a 1 year, we also try to measure that there is a 20 visitation per week. And talking about the crowdfunding, initially, this is a different platform, but in the upcoming features, such as I mentioned before, it will be the integrated and collaborative each other. Because we can, you can imagine that people with the serious problem disease, such as the cancer, they really want to get something like the long-term and the sustainable medical treatment. And they want to raise ₱1 million to get the treatment, right? That's why the crowdfunding will be support people needing the financial assistance, and then they would be connecting with the Homedika as a provider of medical professional. This become our business canvas. From the key partners and then customer relationship, we have a channels, and we try to involve the volunteer as one of our channels. And I would like to emphasize in the revenue model. Initially, the medical professionals have a freedom to determine about the price of their treatment. And in general, there is in general treatment, there is around $3 until $7 per general treatments, such as doing treatment at home. And then 80% from the price will become an income of medical professional. And then 20% from the price will be organized by company. And 5% from the 20% will be allocated for social purpose. That's why we can imagine that there is 10 transactions, so we can have one poor people and we can get a free service healthcare for poor people based per 10 transaction, based on the 10% from the 20% revenue model. And the other 5% for return of investment, 5% from operational costs and for marketing activities. And this will become the general financial projection of this kind of the platform. So what is the differentiation about this platform with others? We have several aspects from the health professionals, from the patients, and also from the workforce productivity system. What's next step in upcoming years of this kind of the platform? Initially, we would like to focus in the product development, so making the platform to be more user-friendly, based both in the website and also in the mobile apps. And we also want to focus on the metric, achievement, business and self-development based on the social media marketing, and also enlarge financial and social impact. This is our team. And finally, we would like to break down the barrier between health communities and also health workers. That's why our platform is to open the door for health access, because we believe that health is a fundamental human right. Thank you.
I have a few questions about the target market. Just correct me if I'm wrong. I understand from your presentation and your business plan that persons who will pay for this would be the middle class.
Yeah, yes.
And for the low-income people, how you are going to support them for health service? Is it from crowdfunding or is it from the service as well?
From the business point of view, we have the transaction and to support the lower or the underprivileged people from our transaction. But crowdfunding is an additional service in our platform.
So the main revenue will be from the middle class people who are looking for better health service? Okay.
So my question is, since this is just a platform, we are not hospital, right? So how can we guarantee about the quality of the service? Are there any standard that you have to combine for, or the ethic or responsible for the result of your consultations to the patients?
Okay, let me tell you about the process of how we can verify about the health professionals. There is almost 1,000 health professional register, but not all of this will be verified. The verification, it means that they can doing something like practical medication to patient. And after this, we also have the several practical approach about this kind of the practice. So they have to use their certificate from the university and also the certificate from the something like workshop that should the health professional and health workers should take during after they get a certificate from university. And based on this kind of the mechanism, they will be get something like the approach from our company, and then they get a verification by our company to do something like practical in medication for people.
So does this mean that like in our country, in Thailand, we have like a medical federation that will governing for the practice of those professionals. So you mean that the company, the Homedika, will be operated under the control of the federation as well?
Actually, because we have a similar, that's why we have a partnership with the institution, and also the something like the vocational health university, and they would we just like the provider of this kind of health professionals, and then we try to connecting to the patients. So what is the about the responsibility? Because we are having full of responsibility to organize these health workers and practice in under our company.
Thank you.
Thank you.
Yeah. Hi. Thank you so much for your presentation. And I was wondering if you could just tell us a little bit more about your team and how you met and how you started and what you envisage your next key hire to be.
Okay. So actually, we have middle up of the team having a several divisions focusing into website developer, international development such as me to apply opportunity in the international and also regional. And also we have this division related about the program, this and the people, and also division related about the crowdfunding. So actually this is a different project, but we in the upcoming features we would like to make it integrative each other and connecting each other.
Sorry, how many of you are full-time at the moment, and are you taking
20.
salaries at the moment? 20 full-time?
Yeah, 20 full time. Yeah.
Hi, can you elaborate a little bit on how you're currently or planning to acquire both the healthcare professionals as well as the patients, the users, onto your platform? Because that would be pivotal into delivering the service, right?
Excuse me, would you like to?
How do you acquire the service providers,
Okay.
right, the healthcare professionals, and how do you acquire the users onto your platform?
Quite.
How do you get them?
Oh, yeah, okay. So actually, that's why we still doing social media marketing. And this platform still will be introduced more and more by the business and sales development, social media marketing and the grounded marketing. In the social media marketing, we have the Facebook ads, and in the grounded marketing, we have a billboard. But we also try to encourage volunteerism by with the social approach with the people. So we have so many connections. If you can see in our business canvas, our channels is very diverse, from the volunteer and also the technology as well.
Yes, also congratulations on your presentation, but we need some more information. Let me just ask a question about your marketing. In your documentation, you say that the provider will set the rate that he or she will charge, right? So therefore, you have to have an idea what people are able to pay to determine exactly what your financial model will be. Have you done any marketing studies? Can you tell us what people are willing to pay for this type of service? What kind of an income class is that? And therefore, within this middle class, what are the people who actually would be able to afford this type of a service?
Actually, this business platform is for anybody and targeted in the middle class of the Indonesian. But we have emphasized the social benefits for the underprivileged.
But that's not what I was asking.
Well, sorry.
No, that's not what I was
Yeah,
asking. Specifically, who are the people who can afford this? Because somebody has to pay. So, what are people willing to pay for this type of service? And who are those people? Very clearly, the poorest will not be able to afford this type of a service. People coming to their homes. So, there has to be at some point an area where people will start to be able to afford this, because it's not only the fee that they will set, but also your additional 20%. So what did your marketing study tell you? Who are really, what is therefore your key marketing target? The people who you think can actually afford this type of a service?
Firstly, I would like to tell about the marketing target is people who are really connecting with the online and internet, and it's in the middle of the economical level of Indonesian. They have because they have mobile phones, because they have internet, and it will really be marketable to introduce about the Homedika in terms of they can get the effective and also the efficient ways to get it treated at home.
Just to go back a bit on the social issues, because right now it seems the issues about the health care services is about price, insufficient staff in the area, and also time, maybe traveling to the crowded area or faraway area. So how you can manage the logistics between the need of people who stay at home and looking for help, and also managing the very limited resources of healthcare staff in your country.
Yeah, actually, it is a little bit. There is discoverable value to ask people, to ask medical professionals to join with this kind of the platform. So after commonly, health professionals have a time in the hospital or in their clinic, but in another way they have also just 3 times, such as the 6 EM from the 12 p.m. from 12 p.m. from the 6 p.m. and 6 p.m. from 12 p.m. So they have a unlimited time to distribute their skill in another around them. That's why we have a server. We have server to connect people in this area, in the specific area, to connect them with the available medical professional and the health workers.